OBGYN group recommends COVID-19 vaccines during pregnancy, another major group to break from CDC. The American College of Obstetricians and Gynecologists, ACOG, is strongly recommending COVID-19 vaccination for pregnant and lactating individuals, contradicting recent changes to Centers for Disease Control and Prevention, CDC, guidelines. ACOG cites overwhelming evidence demonstrating the safety and efficacy of the vaccines during pregnancy, emphasizing the increased risks of severe illness and complications for both mother and infant if infected with COVID-19. This stance follows a similar recommendation from the American Academy of Pediatrics, which also criticized the recent changes to the CDC's Vaccine Advisory Committee. ACOG's continued support for COVID-19 vaccination during pregnancy is based on numerous studies highlighting the increased risk of severe illness, ICU admission, and even death for pregnant women with COVID-19. Infants born to infected mothers also face elevated health risks. The organization's decision comes after the U.S. Department of Health and Human Services removed COVID-19 vaccines from its recommended schedule for pregnant women, a change that bypassed standard evaluation processes and lacked clear scientific justification. The conflict arises from recent changes within the federal government's approach to vaccine recommendations, leading ACOG to cease accepting federal funding and partner with an independent group to provide maternal immunization guidance. ACOG's president, Dr. Stephen Fleischman, criticized the lack of robust, unbiased scientific review in the recently restructured CDC Advisory Committee. Dozens of other health organizations have joined ACOG and the AAP in advocating for continued access to COVID-19 vaccines for pregnant women. Despite the opposing viewpoints, the CDC website continues to list pregnancy as a risk factor for severe COVID-19 illness, supporting the concerns raised by ACOG and other medical groups. The HHS has not directly addressed the evidence supporting ACOG's recommendations.
In our next story, watch. Trump says Chicago likely to be next target of federal efforts to crack down on crime. President Trump declared Chicago the likely next target of his crime crackdown, echoing his deployment of 2,000 troops in Washington, D.C. He characterized Chicago as a mess, despite recent significant decreases in violent crime, a claim refuted by city officials. Mayor Brandon Johnson strongly criticized Trump's plan as uncoordinated, uncalled for, and unsound, expressing concerns about escalating tensions between residents and law enforcement. He emphasized Chicago's own investments in community-based solutions like mental health services and affordable housing, contrasting them with Trump's militaristic approach. Illinois officials universally condemned Trump's proposal. Governor J.B. Pritzker highlighted the contrast between the president's actions and the actual needs of the state's residents, while Senator Dick Durbin dismissed the D.C. strategy as political theater. Other state officials echoed these sentiments, calling Trump's plans an authoritarian power grab and an ego trip. The Democratic Party of Illinois chair called Trump's comments offensive and false, noting their historical echoes of racist narratives about urban crime. Chicago has seen a significant drop in violent crime in the first half of the year, the largest decline in over a decade. Local advocates, like Pastor Donovan Price, also condemned Trump's proposal, arguing that community-based anti-violence programs, not military intervention, are crucial to addressing gun violence. They urged Trump to focus on restoring funding for violence prevention programs instead of deploying troops. It remains unclear how Trump would implement a similar approach in Chicago, given the city's home rule laws and significant opposition from local officials and community leaders. The controversy underscores the deep divisions surrounding crime-fighting strategies and federal intervention in local affairs.
In our next story, Trump says furniture tariffs are coming later this year. President Trump announced a 50-day investigation into imported furniture, foreshadowing new tariffs aimed at boosting domestic production in states like North Carolina, South Carolina, and Michigan. This announcement immediately impacted the stock market, with shares of major furniture importers like Wayfair, RH, and Williams-Sonoma falling in after-hours trading. Conversely, La-Z-Boy, a primarily U.S.-based manufacturer, saw its stock rise on the news. The potential for increased costs due to these tariffs adds another layer of complexity for an already challenged furniture industry. The industry is currently grappling with decreased demand, largely attributed to a slower housing market and persistent inflation. Consumers are cutting back on discretionary spending, impacting sales of furniture and other non-essential items. These new tariffs, if implemented, will add to the existing economic pressures facing the U.S. furniture industry, potentially exacerbating existing challenges related to slowing sales and rising costs.
In our next story, Loni Anderson's cause of death revealed following WKRP in Cincinnati stars passing at age 79. Beloved actress Loni Anderson, best known for her iconic role as Jennifer Marlowe on the hit TV show WKRP in Cincinnati *, passed away earlier this month at age 79. Her death certificate reveals she succumbed to metastatic uterine leiomyosarcoma, a rare form of cancer. Anderson's sharp wit and undeniable talent earned her 2 Emmy nominations and 3 Golden Globe nominations, cementing her status as a television icon. News of her passing prompted an outpouring of grief from fellow actors and fans alike. Barbara Eden, star of I Dream of Jeannie *, described Anderson as a real talent with an impeccable work ethic, while Morgan Fairchild lauded her as the sweetest, most gracious lady. Many others echoed these sentiments, celebrating Anderson's memorable performance as the quick-witted and captivating receptionist on WKRP. Beyond her television success, Anderson also enjoyed a notable film career, appearing alongside Burt Reynolds in * Stroker Ace. Her personal life, including her marriage to Reynolds, frequently made headlines. In her 1995 autobiography, My Life in High Heels *, Anderson candidly discussed her life's ups and downs, embracing both triumphs and challenges with honesty and resilience. Anderson is survived by her husband, children, grandchildren, and stepfamily. Her legacy as a talented and beloved actress continues to resonate with audiences and colleagues who remember her fondly for her unforgettable performances and warm personality.
In our next story, what Ghislaine Maxwell told Deputy AG about former President Bill Clinton. Ghislaine Maxwell, in a recently released transcript of a post-conviction interview with the Department of Justice, vehemently denied that former President Bill Clinton ever visited Jeffrey Epstein's private island. Maxwell stated that while she and Clinton were friendly, and she even visited his home, their relationship was independent of Epstein's. She claimed to have facilitated introductions between Clinton and Epstein, arranging for Clinton's use of Epstein's plane for trips related to the Clinton Foundation, but insisted Clinton showed no interest in Epstein beyond his access to the aircraft. Maxwell detailed her interactions with Clinton, emphasizing their friendship and her involvement in the early stages of the Clinton Global Initiative. She described assisting in connecting key personnel and contributing ideas, but downplayed her own significance in the initiative's launch. Both Maxwell and Epstein, at different points, attempted to leverage their purported contributions to the CGI in seeking leniency during their respective legal proceedings. Despite past speculation fueled by flight logs showing Clinton's travel on Epstein's plane, Maxwell maintained Clinton never visited Epstein's infamous island. She attributed the trips solely to her facilitation and described them as having a humanitarian purpose related to Clinton Foundation work. Maxwell's account directly contradicts previous claims made by others, including Donald Trump, regarding Clinton's alleged visits to the island. The transcript's release sheds light on the complex relationships surrounding Epstein and offers Maxwell's perspective on her connections with high-profile individuals, including Clinton. While her statements have been met with skepticism given her conviction for sex trafficking, they offer a counterpoint to existing narratives regarding Clinton's association with Epstein.